These days, it can be hard to trust the media. What's true, what's fake, and who is behind the message? I'm a freelance journalist and videographer who has spent years studying the media. Now I'm taking a look at what local, regional, and national news stories mean to us here in North Central Washington. I'm Dominick Bonny, and this is Common Sense. Hello and welcome to Common Sense. I'm Dominick Bonny, and today we're going to take a look at Ivermectin, which is an anti-parasite drug that can treat infections caused by roundworms, threadworms, and other parasites. We'll learn more about the details about ivermectin and why it's currently not recommended as a treatment for COVID-19 from Dr. Mark Johnson, an infectious disease expert with Confluence Health, later in the episode. But first, I want to get right to my interview with a local woman named Leanne Lafferty, whose father got COVID in June. He was prescribed ivermectin by a local healthcare provider, and things did not go well. Let's jump right in. Ivermectin.
They were specifically looking for somebody who could prescribe ivermectin. And that was before I even knew that ivermectin was a thing.
Yeah.
But they knew about it.
I see. And was he prescribed ivermectin?
Oh, yes.
I see. And did that do anything for him?
Well, they think it did. He came back home. I ended up going to see him, and they were giving him pretty decent doses of ivermectin every day, even though he hadn't eaten and couldn't really tolerate the medicine. It was making him very sick.
Really?
The rest of my family started taking ivermectin as well because they were given a prescription without being patients, just so they could prevent getting really sick because they'd now been exposed. They even, Carl even told my mom that he would give me a prescription.
Wow.
Yeah.
Without even seeing you?
Never seen me.
Huh. Interesting. I mean, I'm no expert, but that doesn't seem like it's even something that's legal. I'll check into that. Offering to prescribe someone a medication without a first-person consultation. I want to stop here and make a note of this because it's something I'll ask Dr. Mark Johnson about later. I also want to note that I tried asking Carl Lambert about it first. I reached out multiple times through phone calls, and I even sent him a direct message on LinkedIn, which seems to be where he likes to talk frequently about topics like the benefits of ivermectin and call face masks on kids, quote, child abuse. He did not respond to my repeated attempts to contact him. But let's get back to the interview. So he saw Carl Lambert. His condition worsened, you say, over the coming period of time, prescribing medications and practices via text message. And he says in a text message, if your dad is not on an SSRI or antidepressant, the next phase is to add fluvoxamine twice daily for 10 to 14 days. It is the secondary purpose of reducing the macrophage sticky white cells, blah, blah, blah. At the end of that text, he says there is no approved vaccine either. And this was in June, yet the vaccines had conditional use approval for emergency use at that time. So that's not true. And since then, they've actually gotten, well, the Pfizer has gotten full FDA approval. Interesting. And he says to provide warm lemon water, which will help reduce the phlegm. What was your reaction to the lemon water thing? Because I've actually heard about that before, and I thought that it was I didn't actually know that people were legit doing that as a remedy.
They did that. My dad at that time could not eat, could not drink any fluids. It was very scary. We thought we were going to lose him. I could not convince them to take him to the hospital. We were trying to push fluids. We were trying to push calories. So we were trying to give him Ensure. And in those text messages, one of them says, don't give him any dairy. So then they pulled the Ensure and tried to give him lemon water instead. So it was a real battle trying to convince them that dairy was not the biggest problem that we were facing. I mean, he just needed calories. So first of all, he could have, some energy to fight this. But second of all the other medications they were giving him on an empty stomach.
Right.
Concerning to me.
Those are hard to keep down on an empty stomach, I'd imagine.
Oh,
Horse dewormer.
As soon as we gave it to him, his stomach would make noise and his belly would become really extended. I did not know they were giving him ivermectin or what it was, but I saw the prescription on the counter at that point and started to do a little bit of digging, and I just was shocked.
Here's a copy of the text message she referenced. I will also make sure they are provided in the source notes for this episode on NCWLIFE.com. Just go to the full episodes tab and scroll down until you see common sense. This is episode 45. I will also include the text of the complaint Leanne filed to the Washington State Nursing Care Quality Assurance Commission, which is what I am reading quotes from to ask some of my questions.
So at any point did Lambert prescribe or try to get your father oxygen?
Yes, he did.
Okay.
He
And
did
so
get him oxygen.
He got him oxygen, so he is on oxygen in the home?
Yes.
And did that improve you said his oxygen levels were below 90 consistently. Did that improve that?
It was better. He definitely wouldn't have done as well without the oxygen. May have passed without the oxygen, but it wasn't ever at a high enough level. He would barely get up to 90. And when he got to the hospital, they turned it way up because he ended up getting admitted for 5 days after that, where they took all the medications that Lambert had put him on and replaced them with IV antibiotics instead of oral and remdesivir instead of ivermectin. The only drug that is FDA approved for COVID.
Yeah. And did that improve his condition?
Yes.
I see. And so back up real quick to the decision to take him to the hospital. How did that come about? Was that a conversation among, the kids, you guys, your family, or was he like, please take me to the hospital?
He could not communicate at all. I called my cousin's wife, who's a physician's assistant in OMAC, and begged her to come and convince my family to admit him. And when she got there, she couldn't believe that he wasn't in the hospital. With his oxygen levels, he was super dehydrated. He needed, like we said, IV antibiotics. So she did encourage them, and they finally took him to the hospital. But as soon as he got out, they resumed care with Carl.
So he got back on ivermectin?
I don't know. I was kept out of it after that.
Yeah.
Yeah.
Well, I'm sorry that sounds like a stressful situation for you.
It was terrible.
Yeah, I'm sure. And how's your dad doing now?
He's doing okay. I would say his lungs are permanently damaged.
Yeah.
But he's able to walk. I mean, it took a while before he could even walk. He got his ability to speak back pretty quickly after his heart rate and his oxygen and his dehydration all had a pretty big impact. But he's doing okay now.
Wow. Scary though.
Yeah, and I don't trust that there won't be long-term effects. They do classify him as a long hauler.
Oh, really?
Yeah.
Huh.
I don't live with him enough to know exactly what that looks like.
Yeah.
When he's around me, he acts great, but I think his days are really short, how much energy he has.
Yeah. I mean, if you can't get oxygen into your blood,
Yeah.
that has a huge impact over.
Yeah, and when the fires were happening, he wouldn't go outside at all. Just really scared of not having enough oxygen.
Is he still on oxygen?
No, he did get off of oxygen.
Yeah. Wow. Well, it's good to hear he's walking.
Yeah.
Walking around and he can speak. So why go public with this now?
It was the worst experience I've ever been through in my life, and I love my family. They're good people, but they've been completely brainwashed. And they truly believe the hospital was trying to kill him and Carl was trying to save him, and that scares me. Carl told them that he saved over 300 people's lives from COVID. He had a pretty good marketing pitch that he gave them, and I think he's actually expanding to have a clinic in OMAC as well. And it just really scares me that he's promising people a cure rather than the vaccine, which we know actually is proven to prevent severe COVID. He's talking them into getting it first, and then he'll treat them.
Getting
COVID without a vaccine,
Oh.
which, once that snowball has started.
Yeah.
who
Wow.
knows?
Boy, that is wild. I guess the last question I have is always, is there anything else about this story that you want the public to know?
I want them to know that they shouldn't trust what they're reading on the internet. They should trust their local hospital that's begging them to get a vaccine right now, because they're having to prioritize patients and care because they don't have enough resources for everybody. And it's terrifying to me to think that people are willing to go to a feed store and get a drug rather than go and get a vaccine that's so safe and easy.
I want to thank Leanne for her bravery in standing up and speaking out about what is clearly a painful experience for her. I know it's not easy to put your neck out there and speak out against misinformation. I also know it might strain her relationship with her family even more. But still, I think she's doing the right thing because, like she said, he talks about treating other patients, many patients. I do believe that her experience is so powerful and personal, it might just make people think outside their echo chambers for a second and consider the question, what if that was my dad? What would I do if I was in her shoes? Stay tuned after the break for an interview about this with infectious disease expert Dr. Mark Johnson with Confluence Health.
Welcome to CrunchPak, the #1 supplier of sliced apples and a premier employer in the Wenatchee Valley. We are looking to add new members to our CrunchPak team. We offer full-time work with great benefits in a safe environment with fantastic people. As a part of the CrunchPak family, you'll find a home that's all about helping you thrive and succeed. Come see what CrunchPak can do for you. Apply today at 300 Sunset Highway in Cashmere or online at crunchpak.com.
Hi, I'm Chuck Dronan, Managing Member at Eplodolin Retirement and Assisted Living. It's been a tough year for all of us, but especially for those working and living in senior care facilities. Over the course of these many difficult months, our staff at Eplodolin has been vigilant in adhering to federal and state guidelines to protect and assure the safety of our residents and their caregivers. If you're in need of assisted living for a loved one, give us a call at Eplodolin. We're here for you.
It's important to take medication as prescribed and store it in a secure place. But if you have unwanted medication, then proper disposal is important. Always check the label for disposal instructions and remove any personal information. Medproject offers safe and free options in your area to dispose of your unwanted medications. For more information about what services are available in your area, call 844-MEDPROJECT or visit medproject.org. Medproject, safe and secure.
I'm John Divis from Wenatchee Dental Arts, and I like to think myself as a comprehensive dentist. We are an office that treats people comprehensively for their dental problems. We do a lot of general dentistry in a broad sense. We don't send everything out. Things that we have the ability to do in the office, we like to keep in the office and under one roof and keep things as complication-free as possible. You can come to one place and have all their dental needs taken care of.
Welcome back. Let's jump right into my interview with Dr. Mark Johnson, an infectious disease expert with Confluence Health.
So Dr. Johnson, my first question is, why is it not recommended to take ivermectin for COVID-19?
The data we have so far doesn't suggest it works, and there's a potential harm to it. So there was a biologic plausibility. There was a mechanism of action that suggested, well, maybe this medication would have a benefit. We looked at a lot of different medications to try to repurpose them in the way that ivermectin was looked at. And so you start with that biologic plausibility, that mechanism of action showing, well, in a test tube, there's very weak antiviral activity against SARS-CoV-2, the virus that causes COVID. And then you have to test it. And so through clinical studies in humans, we just haven't found a benefit. And not all clinical studies are equal, but what we're looking for is the gold standard. what I call placebo-controlled, randomized, prospective clinical trials, meaning patients are given a placebo or sugar pill versus the study drug, which in the case is ivermectin. And you look to see, is there a benefit? And in those 16 randomized clinical trials to date, taken together, that data doesn't suggest there's any clinical efficacy. Now there's bigger studies ongoing. We should acknowledge that. But right now, the data says that this medication doesn't work for either the prevention or treatment of COVID. And that's how we do science. We started with an idea, we tested it. The data now shows that it doesn't work, and so we can't recommend it. So the consensus guidelines from the National Institutes of Health and the Infectious Disease Society of America, a group of infectious disease physicians like myself, have looked at all the data, very carefully analyzed it, weighted the data based on the strength of the studies that were performed, and identified it just doesn't show a benefit.
Okay, yeah, that's peer review, right? You can get a lot of really smart experts to review the data, and then they come to consensus.
Right.
What are some of the side effects that could come from taking ivermectin, that you got at a feed store?
So a lot of different side effects. I think the big problem there is that at its core, the ivermectin that you get at the feed store, it is in some ways the same drug that we would give for medicinal purposes for treatment of things like certain types of scabies, African river blindness, which is a parasitic infection that doesn't exist here, or strongyloides, another parasitic infection that we don't have in our part of the US. And but the problem is that what you get at the feed store is it's just wrong for humans. The dosing is way off, and so people are seeing real harm from this. So neurologic syndromes, seizures, muscular problems, high fevers, these are all potentially fatal toxicity from a medication that just, in that instance, is not designed for human consumption.
Have we had any ivermectin overdoses locally? And I mean, how does that also, how is that, what is the threshold for an overdose on ivermectin?
I'm not aware that we've seen any in our community, but the CDC did put out that advisory alert to all healthcare professionals about 3 or 4 weeks ago, in which they identified that they were seeing a significant increase in cases of ivermectin toxicity. Primarily, they're seeing it in places like Louisiana and some of the southern states, where some of the usage of it might have been much higher, as they were seeing a huge surge of Delta variant COVID cases. So, but it's certainly something to look for. And so we're always, it is a real concern that it could be happening in our area, but I'm not aware that we've seen it in Confluence Health healthcare system to date. But obviously it's a concern. So for medication that hasn't shown clinical efficacy against COVID at all, if we're seeing toxicity from it, well, we just can't have that. And I should point out that the in vitro or test tube data in the lab that showed maybe it has some weak activity against COVID that led to further testing and clinical studies, that the concentration that was required to get that weak antiviral effect was much, much higher of a dose than we would usually use for those parasitic infections in humans that I mentioned.
Sure.
And as a result of that, you're talking about the therapeutic index or therapeutic window of the drug. And so people would have to take incredibly toxic levels of it to even realize any potential benefit. But again, we're not seeing benefit in clinical trials. So I can't and would not recommend usage of ivermectin for either the prevention or treatment of COVID.
Do you think it's ethical for local healthcare providers to prescribe ivermectin for COVID?
Based on the data we have right now, I don't. That is part of the reason why the FDA and the drug company that sells ivermectin for profit has said, do not use ivermectin for treatment of COVID. And so when the regulatory body says don't do it, and the drug company says there's no data, we make money off this drug, don't do it.
Yeah.
That should tell us something.
Yeah. Yeah. That's a big statement from the drug company. I did not know that. Clarification for me, can you prescribe somebody a medication, any medication, without personally seeing them or consulting with them via video chat or in person? Could you prescribe them medication? So like if I said my brother's sick, can you write him a prescription for Ivermectin or whatever the drug is?
That is not permissible by the current medical regulatory bodies. In other words, there has to be some sort of therapeutic relationship in order to prescribe those kinds of medications.
Sure. Yeah, that makes sense. And my last question is, what happens to a doctor who may be breaking the rules of these boards, these licensing boards that you have to agree to adhere by those rules? What if you break the rules, like prescribe somebody a medication with having no therapeutic relationship with them prior to that? What could happen to you?
That's a complicated question. It could be that if there's no negative outcome, there might be no negative repercussions. But I know that some of the medical licensing boards are looking very carefully at this because they want to ensure that we're providing the very best appropriate evidence-based medical care for our patients. And it is incumbent upon physicians and other licensed clinicians to do that. And so if a provider is falling outside those bounds, the regulatory bodies can take administrative action against that provider.
So the money aspect, people say, you get money for distributing the vaccine. So that's the angle. Doctors want everybody to take the vaccine because it lines their pockets. How's that work? How's that untrue?
That's a good and kind of confusing question for me as a doctor, because I luckily work in a healthcare system who they just tell me, you take the best care of the patient in front of you, and that's that. And so there's always challenges with health insurance and billing and that sort of thing, but the healthcare system does its best to ensure that I'm providing patients the best possible care. And if patients need compassionate care, that sort of thing, that's able to be provided. So I know less about the billing aspect of medicine is what I mean to say. I just know that by and large, vaccines themselves, once they're being produced in large scale, are fairly inexpensive. So it is my understanding that a healthcare institution, when they administer a vaccine, there's some sort of vaccine administrative cost. The actual process of pulling up the vaccine and administering it, and the human resource cost of having people there to give the vaccine in a safe and trained way. But that cost, or the reimbursement to a healthcare system, is very small, especially compared to some other interventions that healthcare does. So that's why people say vaccines are one of the best buys in medicine, because they make a huge impact in preventing disease, and they're relatively inexpensive. But healthcare systems don't make money on vaccines, and they certainly don't make money on the COVID vaccines. And in fact, as you well know, the federal government has gone to great lengths to make sure that COVID vaccines are free to patients. Yeah. So when people say you're making money off the vaccines, that's just inherently false.
Yeah, and in fact, from everything that I've read, Confluence Health and other medical providers have lost revenue because they haven't been able to do these routine procedures and surgeries and medical visits and all those things that generate revenue for a medical system when it's all hands on deck to deal with the pandemic, and those things get shut down and you can't go get your shoulder surgery like you would have been able to pre-COVID. That's a lot of money coming out of the revenue stream there. But the other thing is that these folks, who provide ivermectin prescriptions and hydroxychloroquine prescriptions and these therapeutic protocols and this, that, and the other thing, they're charging a lot of money for this stuff. And this is horse dewormer you can get off the shelf if in normal times for relatively cheap. So there seems to be an economic, for lack of a better term, kind of scamming behavior here from these alternative medicine people.
Yeah, that is for sure a real concern. And obviously, I mean, from my perspective, I want people to get vaccinated because I don't want them to get really sick with COVID and end up in the hospital and die, or be on oxygen for months, or end up with a lung transplant down the road because the virus has ravaged their lungs. But on another more practical level, I want people to get this relatively inexpensive vaccine because I don't want them to end up in the hospital for weeks and weeks and weeks with a huge hospital bill. Yeah. I don't think anybody wants that.
Yeah. Healthcare systems don't make money on vaccines, and they certainly don't make money on the COVID vaccine, he said. When people say you're making money off the vaccine, that's just inherently false. He goes on to say, from my perspective, I want people to get vaccinated because I don't want them to get really sick with COVID and end up in the hospital and die, or be on oxygen for months, or end up with a lung transplant down the road because the virus has ravaged their lungs. But on another more practical level, because I don't want them to end up in the hospital for weeks and weeks and weeks with a huge hospital bill, end quote. Here's a true expert on infectious diseases and a representative of Confluence Health saying they don't make a bunch of money off vaccines or the distribution of them. But what I don't know is how much money Carl Lambert and others like him are making from prescribing a drug that feed stores have pulled off their shelves. I know this because I went to Coastal Farm and Ranch in East Wenatchee and saw it for myself. But because Mr. Lambert would not respond to my multiple attempts to reach him and get his side of the story, I cannot understand his motivations or his actions. I cannot get a handle on how his business model works. But it seems to me that when you have roughly 71 million Americans irrationally opposed to taking a safe, free, and effective vaccine that is FDA approved and proven to work, that's an opportunity to make a mint by giving these folks exactly what they want, which at the moment is livestock dewormer. What the next irrational fad will be is anyone's guess. What I do know is that Ms. Lafferty's decision to go public with this information is not only brave and selfless, but I believe she is giving voice to thousands, if not millions, of Americans who are in a similar situation. And they're not in that position because of a complete cognitive deficiency in their friends or family members. Rather, we have all had to endure this seemingly never-ending slog to get through the pandemic, in large part because of a calculated disinformation campaign orchestrated by bad actors, many of whom are ironically vaccinated themselves, but make money off making common sense public health measures into political and cultural battlegrounds. It's times like these, times of crisis, when snake oil salesmen, grifters, and charlatans flourish. And it's at the expense of the rest of us. That's all for this episode of Common Sense. Join me next week to learn about Robert, a local man born and raised in the Wenatchee Valley, whose addiction started in his early teens after being overprescribed opioid pain medications after a tractor accident. Now he's 28, homeless, and an intravenous drug user who says he's overdosed 38 times. The last 3 times it was Narcan that's helped save his life. I'm Dominick Bonny, and we'll learn more about that the next time on Common Sense.
Your search for quality patio furniture with excellent customer service is over. Blue Lagoon is proud to offer only the finest outdoor furniture and accessories from some of the most renowned manufacturers in the industry. Our showroom showcases a large selection of in-stock furniture, fire pits, umbrellas, cushions, and outdoor accessories. Our in-house outdoor decor specialist is available to help you design and custom order the perfect furniture for your unique space.
I'm here at the Discovery Center at Rocky Reach Dam, where there's a ton of cool stuff to do. You can learn how the dam harnesses the power of the Columbia, walk inside a Native American Tule Lodge, and steer clear of disaster on the Rock Island Rapids. You can check out the new fish viewing space and even stare a salmon right in the eye. Explore all this and more at Chelan County PUD's brand new Discovery Center at Rocky Reach Dam, now open year-round.
Hey everyone, Fletcher and Amy Ellingson here from Live It Up. Join us every week as we answer your questions on health, wealth, and relationships.
We're all about you creating a life that you love, so tune in to Live It Up.